You are now listening to Nailed It, the Orthopedic Surgery Podcast.
And moving forward to some neural tissue tumors, can you walk us through some of these? We mentioned one a little bit earlier in conjunction with neurofibromatosis, but can you walk us through these?
So the MPNST is the sort of poster child of malignant nerve sheath tumors, as its name would imply, and it has two benign kind of correlates, and those are schwannomas and neurofibromas. I don't want to get into a ton on the benign stuff because our job here is to talk about sarcomas, but we see MPNSTs like we talked about earlier in patients with neurofibromatosis, but you can get them in patients without NF, right? They can just show up on their own like any other soft tissue sarcoma. You're going to see those same characteristics. So hypercellular, lots of spindle cells. Here, they tend to organize in a whirling pattern. So different than your herringbone, different than your storiform. These are whirling, and they will be S100 positive, which is common for any type of nerve tumor. But histologically, these look a lot more biologically aggressive than their benign counterparts.
Yeah, and do these typically progress? I mean, I assume if they're close by nerves, that they may present with some nerve symptoms. Is that a common in your experience? Did you see them? Hey, I'm having if this posterior tibial or tibial nerve, they come with, hey, I'm also having some, numbness and tingling in the bottom of my foot. Plus, there's this mass, or is it more just there's this mass?
I think I mean, some do and some don't. It depends on how rapidly the mass has grown and how much it's compressed and where that nerve is and stuff like that. But oftentimes nerve tumors present earlier because they tend to be symptomatic just for that reason.
Okay.
They're in or on a nerve. And when you bump it, right, like, woof.
Ooh, that hurts.
Yeah.
Okay. So big things to know about nerve tumors is definitely like that whirling pattern that you talked about in comparison to the herringbone pattern when we were talking about fibrosarcoma, and the storiform pattern that we were talking about with undifferentiated pleomorphic sarcoma, those are fibrous tissues. This is a neural tissue, and then this is S100 positive. And treatment for these is pretty much the same, wide excision plus minus radiation.
Plus radiation. Yep. Plus radiation for the high grade ones. And then chemotherapy, much more controversial, a treatment option.